including report, to the end of your sim, 15 minutes.
Okay.
And then we will spend 15 minutes chatting about how sim was, okay? So
Okay.
big breath in. Oh, big breath out. So we will start at 11:22. Is that what you have?
I got 24, but mine's a little bit ahead.
Okay, I'm going by my watch.
Okay.
22, 32, 33, 34, 35, 36, 37. To 11:37 is when we'll stop. Okay? Now, so what I want you to understand is that right now I'm giving you a report. I'm the night shift, you're the day shift. It is 0700. When you get to the patient's bedside, it will be 0730, just to give you a frame of mind, okay? So, in room 228E, bed 2 is Ivana Degree. She's a 30-year-old female, no known drug allergies. She was admitted 3 days ago through the ED with complaints of dry cough. She had pleuritic chest pain, dyspnea, fever, chills, fatigue, trying to speak slow, and rigors. She was diagnosed with community-acquired pneumonia. So we anticipate discharge home either today or tomorrow, but that's all dependent on the chest x-ray that the physician ordered for today. She has an 18-gauge IV to her right AC, and I DC'd her IV antibiotics were DC'd yesterday, and she was started on PO Levo. I gave her her first dose yesterday, last night about 2100. No, it was given yesterday at 0900. Excuse me, 0900. I'm sorry. Vital signs, temp is 99.1, and that's trending downward. Heart rate is 84. Respirations are 18. BP is 128/80. Her O2 sats for me since midnight have been 94 to 96 on room air. But what she does is when she starts coughing, she picks up her oxygen and puts it back on. I think it just gives her some peace. She was in pain, that pleuritic chest pain last night, and she rated it 7 out of 10. And so I gave her the hydrocodone at 2100. She went to sleep after that, but when we woke her up at 4 o'clock for that last set of vitals, she said she was feeling better. She didn't rate it or anything. She just said at that time she was feeling better. She voids in the bathroom. Her last CM was yesterday. She's now eating small amounts of food, but if you would encourage her to drink fluids, she's doing okay with it, but I think it could be better. And I just know that she doesn't like ice water.
Okay. So, the vitals were taken at midnight?
At 4 this morning.
At 4 this morning?
Yeah, that was the last that I got on her.
Okay. So the O2 saturation was at
94, 96.
Okay.
Yeah.
At 4 in the morning.
Yeah.
Okay. Okay. And what's her INO?
Intake yesterday was about 2100. Output was, I think, 25, 28, 25.
Okay. And when was this last recorded?
Last what?
When was this recorded, the INO? The 25?
Oh, yesterday.
Yesterday? And we're still, the CBC, the blood work was taken, and we're still pending results?
Yeah.
Okay, so medication was taken last night, feeling better. She hasn't taken anything else. So no medications were given as of right now.
Right.
Alright, so I'm gonna go ahead and wash my hands. patient's room. So much. Knock, knock, may I come in?
Absolutely.
Hi, my name is Alicia. I'm a student nurse. I'll be taking care of you. I'm closing the door for privacy and the curtain. Also, I'm going to raise the head of the bed, okay?
Sure.
I'm just going to verify some information.
Sure.
Can you please state your name and date of birth, and I'm going to look at your wristband as well, okay?
Sure. Ivana Degree, XXXX.
Okay, and I'm verifying the MRN number with the chart. And are you allergic to any medication, food, or the environment?
Nothing that I know
allergies?
of. Nothing that I know.
Okay. And are you experiencing any pain right
Just want to cough.
now? You just want to cough? Okay, but no pain. All right. So
Just when I cough. Yeah, I've got pain
just
when I
when
cough.
you cough.
Yeah.
Okay. And so when you cough, where does it hurt?
At my upper chest.
Okay. And can you, from 0 being no pain, 10 being the worst pain you've ever felt, can you rate the pain?
I've got a 3 or 4.
3 or 4? Okay. And does it radiate to any other part of your body?
Sometimes it feels like it's going through to my back, but just for a split second.
Okay.
It's really just in my upper chest.
Okay. And do you feel any other symptoms like nausea or vomiting or any dizziness when you cough?
No.
And when you experience the pain? Okay. All right. I'm just gonna go ahead and assess you.
Okay.
And I'm gonna go ahead and I'm just gonna verify your pulse ox too.
Sure.
I'm gonna put this one in. So see how you're doing. How are you feeling overall?
And your pulse ox is 96%.
Okay.
Overall, I'm okay. I'm ready to go home.
Yeah.
Anxious to go home.
So we do have orders that you will either be discharged today or tomorrow. We are waiting for the chest X-rays to be done to see how well you're doing. So I'm gonna go ahead and assess you. Is that okay?
Sure.
Just gonna verify your lungs.
Okay.
Your respiration.
Okay.
I'm just gonna move this. I'm also gonna check on your sign. And are you able to sit up? I'm
Yes.
gonna have you sit up.
And I'm sitting up.
Okay, so I'm gonna check the back of your on your back.
Okay.
Sound on your back.
And how many areas would you listen to?
Huh?
How many areas would you listen to?
6 to 8.
Correct.
So,
Okay, thank
and
you.
on both sides. Okay. All right. And so I know that so you're receiving oxygen,
Yes.
and but we are going to be decreasing the amount to start weaning you off. So when you're discharged, you can be breathing on your own. So I see that you're at 2. I'm just going to go ahead and reduce it a little. Okay.
Okay.
How are you doing?
I'm okay.
Okay. I'm assessing your IV, and I see that there's no inflammation, no redness, no infiltration or distension, and I see that it's actually on the left hand. So I'll go ahead and document on the chart because I see that it was on the right. but I can see that it's on the left, so I'll go ahead and change that in the chart. And I see that it's blue, so I'm going to also document that it's a 22, not a 18. Okay. And so I'm gonna go ahead and when was the last time that you voided? That you used the restroom?
Oh, this morning when I woke up.
This morning when you woke up? Okay. And the last time that you used the bathroom, you passed the stool?
Yesterday.
And have you been walking?
Oh
and
yeah.
moving?
Yeah.
And how about your fluids? Have you been drinking water or fluids like juice?
I'm not a great water drinker. I'm not a big fan of water, but I've been trying.
How much have you drank?
Oh, maybe that bucket and a half, something like that.
Since when?
In a day.
In one day? Okay. And so we're gonna have you and I know that you don't like ice water. So is there anything that you would like? Maybe like a certain type of juice that I can bring you that so you can increase your intake?
I'm a coffee
Liquid?
drinker.
Okay, coffee. How about juice? Any juice?
I'm not much of a juice drinker,
Okay. How about
but I'll take orange juice.
orange juice?
Yeah.
Okay. Okay. And I see that you're up for your medication. We're gonna go ahead and give that to you at 8 because you are due for your antibiotic. And would you like some cough medication since you're still coughing?
Okay.
Yeah. Okay. So we'll go ahead and give you that. And how are you doing with your? I see that you're a smoker. So the nicotine patch is also due to be changed. So we're gonna go ahead and do that. Where's your nicotine patch right now?
Oh, I don't know.
Okay, so I'm gonna go ahead and check because I'm gonna do alternate sites. So if it's on the right, so we're gonna go ahead and just place it on your left hand. Is that okay?
Sure.
Okay, and how about, have you been using the incentive spirometer?
Yes.
Okay. And I'm gonna go ahead and, how often are you using the incentive spirometer?
They said something about so many times an hour. I forget how many times an hour they said, but I've been trying.
Okay. Yes, so it's going to be up to like 10 times for every 2 hours while you're awake.
Okay.
And do you know how to use that?
I think so. I've been doing it.
Can you show me?
Sure.
Okay. So I'm gonna go ahead and give this to you, and I just want you to demonstrate how you're using it to see if you're using it correctly.
Suck in, hold it, blow out.
Okay. And do you know where the level is for where are you trying to reach? What level? Is it best, better, good?
Mine's kind of down there at the bottom.
Okay. So are we striving for best?
Striving for best.
Okay. Good. And I see that assessing where the nostrils is, it's a little bit red, so we're gonna go ahead and clean you there and provide some care so it doesn't get any redder or any inflammation. And I'm gonna go ahead and assess your abdomen. If I don't see any distension, I'm just gonna go ahead and assess. I'm gonna listen to your bowel sounds.
And time is up. I love it. Okay, come sit down here with me because I asked a question. I've given you a sheet of the questions that I asked. I'm just going to turn around and write your answers on the back. So number 1, how'd you feel throughout the simulation experience? freaking relieved that it's over.
Relieved that it's over.
Yep.
I tried to remember everything that I could regarding like the respiration, what to look for, to really assess the patient.
Were you nervous, anxious, calm?
I was nervous. I was a little bit calm because
I think so.
Since I did research, as to like how to take care of the patient, I wasn't as lost as I was before.
So did you guys have have a diagnosis before you got here?
Well, yeah, they had placed that it was a 30-year female and with pneumonia and the medications.
Got it.
I tried to reach and do research on that.
Okay.
And I just tried to remember like questions to ask to see how she was doing.
The other day when we did it, do you feel better? Same? Worse?
I do feel better because way better than the last time. Because I prepared myself.
Yes.
Better than the last time.
So when we do sim again, I want you to remember that you said that I feel way better than I did the last time.
Mm-hmm.
Because when you do sim again, you're going to say, I felt way better than I did this time.
Yes.
The more you do it, the more you get exposed to it, the more knowledge you gain, the more comfort that you have. At the end of the day, what you need to remember is that the sim is not designed to catch you, fail you, pass you. That's not what sim is about. Sim is so that you can see where you're at, what you're doing really, really well, and what you need to work on in a controlled environment where nobody dies. That's the joy of sim. Because used to be we taught you live with a patient, and now we get to control the environment. That's what that's about. So were you satisfied with your ability to work yourself through the sim, work yourself through hiccups, work yourself through things that maybe when you felt like your nerves were getting, or you couldn't remember, did you feel like you could work yourself through that?
Yes, I do. I just tried to look up different, like remember different things, keep assessing the patient. If something else came to mind that I had to do, then I did it, so I kind of like worked it where I went back and forth,
Did you feel like when you got stumped, maybe if that's the correct word, that you went back to what you knew? You went back to your comfort zone.
Yes.
And the comfort zone was maybe assessing, or the comfort zone was teaching. You teach a lot. So that's good. That's very good. So name the things you did well.
So I remembered the oxygen, and the IV, and remembered that in the chart it stated that it was on the right, but it was actually on the left.
I think it's just an error.
Okay.
I don't think that, but I'm glad you caught it. Remembered oxygen, IV placement. Okay. And you looked at the IV and you addressed the IV,
Yes.
and you said whether it was any redness or irritation, right? I would caution you to add dressing in there. Make sure the dressing is intact, but good job. What else did you do well?
I assessed the lung sounds. I remembered, I noticed that the patient was lying flat, so I raised the head of the bed. I asked the patient to describe the pain. I asked the patient to show me how she would use the incentive spirometer. I assessed the pulse ox. I verified the patient name, date of birth, and MRN, and allergies. I introduced myself. I washed my hands. I provided privacy.
You hit all the critical elements. Yep.
I assessed for the oxygen, because I did read that it was a little bit red because.
What can you do about that?
I was a little bit like stuck on.
You were thinking, oh God, don't ask me.
So I would provide care, like clean it. I'm not sure if there would be like water-based, maybe like gel. I would have to look into that, or hospital.
Can you put some
products.
Vaseline or something up there?
Vaseline, it would probably burn the patient.
Got to watch for combustibility.
Yes.
Okay.
Yeah, I can. Okay.
What did you feel like her primary goals were?
Her primary goals were to be able to breathe on her own.
Okay.
So that's why we were weaning off the oxygen. To be able to, I forgot to ask about like how she was coughing and if she was coughing up any mucus. So we would want her to keep coughing up so she can clear her lungs. Goal is to have her vitals stable, and her to keep taking the antibiotics, the full, prescription antibiotics, so she can get better, and just be able to leave the hospital and care for herself. Yeah.
Go home. That's right. So just on that note, how do you wean somebody off of oxygen?
I was gonna ask and I forgot. I just assumed that we would just lower.
So use your critical thinking skills. How do you wean somebody off oxygen?
You little by little decrease the amount.
Okay. At rest or activity? Which one?
I would assume that activity or rest, no, or both. I don't know.
Last answer.
Both. Okay.
So when does discharge planning begin?
Right when they're admitted.
Day of admission.
Mm-hmm.
And so the discharge plan is that she's going to eventually go home.
Yes.
She didn't come in with oxygen. We don't want her to go home with oxygen.
Mm-hmm.
She's a smoker, so we don't want her to go home with oxygen. So you start weaning her as soon as you can. And the way you do that is you can either take the oxygen off and keep a pulse ox on her, or you can titrate it back down. If it ever falls below that 94 that was in the chart that said keep it above, then you put it back and say couldn't tolerate it. You always want to assess your patient with and without oxygen at rest and on exertion. Because the worst thing that could happen is that you never tested her on exertion. She goes home, she lives with her husband, he wants her to cook supper when she gets home, and she's sitting outside by the pool smoking a cigarette. She takes the dog for a walk and she gets her halfway around and she descends, and now she's back in your ER. So always make sure that whatever you do, you assess the effectiveness of it. If you don't plan to keep her on it, assess the ability to get her off of it. Okay? If you were able to do this again, you would ask about the phlegm. What else?
Assess the patient while she was moving with the oxygen. I would have her like sit up, or even get up. Have her sit on the chair. If she needs to sit down. I'm not sure what else.
Would you talk to her about smoking? Would you talk cessation?
Yes.
Okay.
So we would talk about smoking, her habits, give her resources. If she does want to stop smoking, then I would provide with resources and information on how to quit smoking, because obviously the patient has to decide to quit. If they don't want to quit, they're not going to do it. So willingness.
So overall, pretty good job. What was her blood pressure?
I have it on my notes. I don't know if I remember.
You didn't take it.
Oh no, I didn't. All right, it was after.
You didn't take it. That's one of the critical elements, is to always get the vital signs. What was her temperature?
Well, I didn't take any of the vitals except for pulse ox.
Correct. So that you wouldn't get points for that. So make sure that when you're doing those things, make sure that you try to cover all the aspects of it. Overall, good? You feel good?
Yeah.
Yeah? So what?
I'm okay.
Right. So what we do is I'm going to keep this sheet. I'm going to keep it, and then we're going to use it in the clinical setting, and I'm going to say, hey, do you remember when we had, because you'll have her again, believe me, when we had this, make sure you do this, or what is your plan, or what are you going to teach on, or that sort of thing, so that we can learn from it and glean from it and take what we've learned here today and carry it over into the clinical setting. This is a controlled environment. That's a non-controlled environment. So overall, Good job. You got some skills, girl.
I'm trying.
You are. It's hard, isn't it? It's very hard.
And I'm like, I just feel like I'm just gonna kill the patient. That's what comes to mind. I'm
Absolutely
like, I don't
not.
wanna do that.
So let me tell you, that's what we do here. That's the purpose of sim. I don't ever want you to see it as it's a pass fail. I did amazing or I sucked. Most of us walk out of sim thinking that we suck, and that is not at all the goal. The goal is for you to take this moment in time and say, I did great. I can improve here. When you've compared yourself several times to before. That's what you did good. When I compare myself to where I was before, look at where I'm at now. You're going to be shocked at where you're at the end of the semester. You're going to sit there and go. So overall, excellent job. There's your folder. Take credit for everything, okay? Make sure I get that back. Turn your camera off there. Make sure I get